Welcome to the New Voices of Influence, a survey of emerging digital HCP opinion leaders produced by LiveWorld, a leader in HCP digital and social marketing. I'm Umar Siddiqui, Chief Medical Officer for LiveWorld.
Today, we have Dr. Chet Donnelly joining us. So, Dr. Donnelly, could you tell us a little bit about your background?
First of all, thanks guys for having me on the program. I've seen it for many years now, both kind of on various social media things and also highlighted on LinkedIn from time to time. So I kind of feel like I've reached the next step of my career, making it to here. I'm not the president of the academy yet or anything like that, but this is, building blocks to get to your end goal, if that's one of them. In terms of my career, I'm young into my career. There's no secret about that. I'm only about 2 years out of fellowship. My fellowship was at Rothman Orthopedic Institute. And before that, I did my orthopedic surgery residency at University of Miami. And then prior to that, I went to med school at Texas Tech. Prior to that, undergrad in my hometown of Dallas at SMU. And then grew up here in Dallas, and I currently practice here in Dallas at Texas Spine Consultants. It's a 4-person spine group with one pain doc in our group.
So when and why did you become active on digital media? And we also learned that you actually had a alias at one time, some anonymity, some reasons around that.
Yeah, I initially was doing it actually during residency. When I was doing it then, maybe I was just posting, the whole thing was just posting board review questions, just questions for, at the end of your training, regardless of what you're in, you usually take a training exam that justifies your smartness of being a doctor, for instance. And so for orthopedics, we have one at the end of it. And so it's one of those things where I was like, well, if I'm going to use Instagram from time to time or all the time, maybe I can make some educational content out of it. And one of the ways that when I study, you make flashcards, it's kind of like you test yourself. So I was almost doing it. I was making test questions on Instagram, kind of just putting it out there. And then that kind of caught off and grew a little following when I was a first or second year resident. And, something where I was only putting up a post of some gnarly injury, maybe once every couple months, and then saying, well, how would you treat this A, B, C, or D? And then I'd even show maybe an open femur fracture and just kind of say what the management of it was. Really not putting much thought into what this was, but it was slowly growing a following. There might have been honestly like a year or two at a time where I didn't do one post, but I kind of just had it there. I didn't say where I was. There's obviously, I wasn't having anything that was a HIPAA issue, but your bosses probably don't want you putting up pictures of their patients on Instagram. That's just not okay to do, obviously. And that's something, when I talk to other programs about how to start, I tell them, don't 100% follow what I did, as don't put up pictures of patients. There's other ways you can do this. And we'll get into that later in our talk about how to start up. That's kind of how I did it. And then once I became on my own, out of training, I just converted the name to my own. And now I just use it more of an educational aspect.
That's great. The ability to educate and inform your peers from what we've learned at LiveWorld, that peer-to-peer communication, supportive data, and crowdsourcing case information is probably one of the best ways for HCPs to engage digitally. So what would you say is your mission and primarily your audience at this point?
My audience is still 100% focused on other healthcare providers. I jokingly say I'm not a plastic surgeon or dermatologist, so I'm not trying to market directly to patients. That's not my goal. I don't think, again, what do I know? I'm only 2 years in. I don't think spine surgeons should be marketing to their patients on social media directly. I think if you find your surgeon on social media, maybe you should ask around a little more, to be fair. And I'm able to call it out on its own. So really my point is just to have a conversation digitally with surgeons. First of all, I didn't realize it'd be internationally. There's really, when I put up posts on Instagram or LinkedIn or memes that make fun of the rivalry between orthopedics and general surgery or ortho versus neuro, I must get 40 comments from people not even in North America. And they have the same debates in Egypt and Saudi Arabia and Japan. And it's kind of amazing that, wherever you go, we're all different. We're all pretty much the same in a way. So my audience really is just anyone in the medical professional. It's not just spine surgeons. It's not just orthopedic doctors. It's physical therapists, chiropractors, pain management docs, family medicine, internal medicine. And then also sometimes it's those like trying to become doctors in medical school or even in the pre-med route, just getting an idea of what we're talking about.
Well, that's great. It seems like you quite have a broad reach across the whole care continuum in terms of providers. So in terms of the current climate and obviously with the ongoing pandemic that we've experienced, how would you say that has changed patient relationships with telemedicine, virtual care, engaging on Zoom, themselves doing a little research on digital health and using social media and technology?
Omar, that's a perfect question. It's something where if I was told I had to see my primary care provider on a Zoom meeting 4 or 5 years ago, I would be like, that seems pretty lazy. I don't want to do that. I want to go into the office. Like, I don't want to do that. Now I prefer to do that unless you actually need to see a physical exam on me, which, depending on your age, it might matter. I'm like, I don't really want to go into the office necessarily. Zoom has changed the game, or Zoom, Doximity, kind of any digital HIPAA compliant way to talk to patients has changed the game. I use it extensively for even patients locally that might live 20 minutes away from my office. If we're ordering an MRI, I just tell them, hey, I'm going to shoot you a text message or an email around this time. It'll share our screen and I'll just go over the MRI with you. And, 9 out of 10 patients, if not more, love that. They don't want to drive, park, go on the highways, especially like the dangerous Texas highways. They don't have to wait in the lobby just to go through the whole process, just to see me and go over the MRI. That's kind of a beatdown. So this actually makes healthcare that much more efficient. My patients like it. And then also I can kind of show them very specifically when they're sharing the screen, they can do screenshots of it even and really get an idea of the MRI we're talking about. And they really understand it better when we do it digitally.
Yeah, it definitely seems like there's an enhancement in the provider-patient experience. So how would you say that social media has changed how patients are accessing information now, whether it's background, learning about different treatments, or hearing what other patients are saying?
Exactly what you said. It's really, prior to social media, you'd go into Google to search your condition. You always hear about Dr. Google. And from there, you'd probably get directed to the higher search engine optimization groups, such as Mayo Clinic or Cleveland Clinic, who are obviously fantastic, but they're going to give you understandably very generic understandings of what sciatica is, what back pain is. And those are great, but they're also not necessarily through those websites connecting you to patients or connecting you to providers, because that's what the internet is essentially in terms of a Google search engine. What social media has kind of shifted into, and especially exploded since COVID. And there's actually, if you go into PubMed.com and you search social media COVID, there might be 200 publications just in the last 3 years about this, but it's really shown that providers have used social media, which used to be kind of a term just for kids in high school and college, but now professionals are using it to kind of get out the message. And it's one of those things where that's where the market's going. The generations are those that were in their 30s, 40s are now in their 50s, 60s. Some of these people grew up with social media. Our parents have social media. That's kind of where we're at. So it's a way we can connect with patients. And it's one of those things where if you look at it from like a heroic standpoint, I'd rather be out there putting out the good information than other people out there, as we've seen with COVID and vaccines, not getting political, but there's so much bad information out there either way that it's nice to have people out there that are really supporting the good information in terms of spine surgery, in terms of spine disease, back pain, and kind of giving you reliable, honest answers.
Yeah, absolutely. If anything, digital and the internet has democratized information. Now it's a matter of adding a source of truth to it to validate. So what are some top trends that you're following that are of particular interest to you across digital healthcare?
I think part of being able to do telemedicine remotely, that's something I have a couple publications on this. So it's one thing to do a follow-up if you live in Dallas, right? And I'm in Dallas, obviously. But what if you live 6 hours away? What if you live, I've had one patient from Spokane, Washington. I have like 7 patients from Florida. That's obviously not an easy follow-up. And there's also a lot of commitment and trust of a doctor that they meet online that they're going to fly in to have surgery on. That's a whole different process there. So having a protocol and a safety net in place is kind of a big deal. And there's also a certain amount of awareness the doctor is going to have. I'm happy to do, if a patient wants to fly in for a ACDF, like a short, easy, sometimes outpatient surgery, a microdiscectomy or laminectomy, of course. But if I'm going to be doing a multi-level fusion or a front back fusion on a patient that lives out of state, sometimes I think that could be argued as a little selfish, because those patients are statistically likely to have some type of complication. And if you're not really in that hometown to take care of it, then you're really passing the buck to someone else. So I think in terms of trends, while I'm a big supporter of telemedicine, I think we don't want to get too ahead of ourselves, and we need to have some self-awareness that we shouldn't be doing certain surgeries on patients that don't live local. But there's also, most of these patients I'm operating on, they're not coming from Miami or Atlanta or LA. They're coming from about 3 hours outside of those cities where they might have one spine surgeon in the area. So them traveling 30 minutes to an airport and then flying to Dallas and then driving 20 minutes to my clinic, that's not a big deal for them. So these patients that are from more rural areas are utilizing telemedicine. I think the telemedicine trend is just going to become more and more important.
That's a great observation. I don't know how well thought out it's been for exactly what you just said in terms of market access, logistics around networks. and looking at the payer provider models, aside from what you just said in terms of the care continuum and continuity of care for those patients in their local market. So no, that's a great way of looking at it. So how would you say we could reach patients and caregivers using digital tools now differently than we did previously? Like the previous was like, whether it was doctor to doctor faxing, obviously with the EMR tools, but now, like you mentioned, Doximity has their direct dialer and direct call feature, Zoom and other things. So two parts to that question in terms of patients and caregivers, how we can utilize those tools and how could we get them to come on board a little bit more with that?
Well, I really like the Doximity tool of, instead of having to do, how about this, whenever a doctor was calling you, they'd always do *67 and block their number because even if you like the patient, you don't want them to necessarily have your cell phone number because, you just don't. But with Doximity, that's like a nice new modern 2021, 2022 advantage of it changes your number to show that it's that doctor calling you. So frequently I'm having patients, they don't screen my calls, they answer immediately. And that's a really nice advantage. That's another aspect of telemedicine that, I don't know if it had to be for COVID or just the technology, but we didn't have that changing of making a HIPAA compliant number technology available even just a couple of years ago. In terms of the Zoom access and having patients be more comfortable with telemedicine, it's not just me as a spine surgeon that's doing it. It really starts at the primary care level. Those are who are seeing patients the most. And they like it because in terms of checking on patients, they see so many more patients during a day than I do. They're obviously trying to keep the reason it came about, they're trying to keep the exposure of COVID low so they can check on their patients via telemedicine. So they're the ones that kind of train their patients in terms of how to access a link and get into a HIPAA compliant chat room. In terms of working with other healthcare providers, it's been nice for me. There's, as opposed to the old way of meeting new providers, I would wait in their lobby for 45 minutes, then have a 1 hour lunch with them. Or maybe they came in for 10 minutes of that lunch. That's 2 hours away where I could have been doing either time with my family or more time with my patients using the digital aspect of Zoom. Now that it's a lot more normalized in terms of meeting people for the first time on Zoom, I can just set up. I've done 3 Zoom meetings just this weekend with primary care providers here in my local Dallas area. I did one at 2, one at 2:30, one at 3. And just like that, I meet 3 doctors over the weekend. We exchange numbers. I get to kind of give them my spiel about how I think I can really help them out. And it's just kind of another great aspect that 4 years ago, if I told a doctor, can I meet you via Zoom? They'd be like, wow, this kid's really lazy, or what the heck is Zoom? Like, get out of here.
To build on that, I mean, there's a safety element, reliability, efficiency, and the sense of immediacy too, where your time is valuable, their time is valuable. So what do you think is next? Is Dr. TikTok going to replace Dr. Google, you would say?
I think so. It's, I'm not sure how proud I am of it, to be fair, but Becker's highlighted me this week without me knowing. I was in a patient's room and my phone was just blowing up and I was like, what is going on? And I got more text messages this week than when I had both of my children combined. That's because Becker's mentioned that I had one of my videos for cervical disc replacements cross 1 million views on TikTok. And it said the spine doctor with 1 million views on TikTok, and everyone reads Becker's. That's in like the healthcare world and the spine world. And my goodness. So my whole argument, I never thought I was going to be using TikTok as a social media platform. I always thought that was for like middle school kids and maybe high school kids. And why am I even using this? It's not like those people ever really need spine surgery. But it was actually one of my buddies named Matt Harb. He's in the kind of Maryland, Baltimore area. He was one who turned me on to it. He's a joint surgeon. And he was telling me, he's like, I do multiple surgeries a month from people that travel that found me on TikTok, and they're all in their 60s and 70s. So I was like, fine, I'll give it a try. I already do this on Instagram. I would do this on LinkedIn. I can just put my same content on TikTok and just add some fun little music and we'll see. And I've been shocked. Some of the comments, I must get 4,000 comments on some of these videos. And, every now and then it's, spine doctors are evil, or like, ooh, it looks bad. But the other 90% of the comments are actual patients who either had the surgery, have it coming up, or want to know how to get more information. And I've been shocked. These aren't patients that are kids. They're actually grown adults. And the patients that, now that I've been doing it long enough, I've built up somewhat of a following. I must get 2 new patients a week in my office that drive from far, like 6 hours away, far north, Louisiana, Oklahoma, kind of rural areas where they don't have as many access to providers. And again, these aren't people in their 30s, 40s that you would think are using social media or TikTok. These are honestly people in like their 60s, 70s that I'm shocked have any social media, let alone TikTok out of all platforms. So I kind of hate that my secret's getting out a little about how I'm getting new patients and how I'm booking surgeries at a higher rate than my peers. But as stupid or as silly as it sounds, it's kind of the free marketing. I haven't spent one dime on Facebook or Instagram or any of those ads. I've spent money on Google ads, but I don't think I've had any patients say, oh, I just Googled you and found you, right? That's not exactly how it works.
Well, first and foremost, congratulations on millions of views, thousands of comments. You have arrived. You have gone viral. So
I know I'm a little embarrassed it's on TikTok. I wish it was for curing cancer on like in NPR radio or something like that.
No, you're able to spread the word. Not only are you having some engagement, but you're also having some outreach through this to reach an audience that previously would not have access to this information. So that's first and foremost, I think, one of the key salient points of digital. Towards as we wrap this up, what would you say is next for you?
I think you want to try to expand this a little more to the thing I like doing the most of all surgeries are I love cervical disc replacements. I think those are the patients that get well really fast, that if you do the appropriate diagnostic workup with selective nerve root blocks, conservative care, those are the patients that just excel. So I'm trying to build more of a niche of being a cervical disc replacement expert. That's something where my training was extensive in. I've worked with a couple different companies on this, and I have a product I really like. So that's one aspect where I want to try to tailor more of my marketing towards is non-fusion. I know there's controversy in the lumbar spine, but for the most part, people agree that 1 and 2 level disc replacements in the cervical spine, there's not much debate as long as we follow the very clear-cut guidelines that some of my mentors helped create from day one. So in terms of the future of my career, obviously I do everything from the skull down to the pelvis, deformity, skull, and all that stuff. But every spine surgeon will tell you they love just doing disc replacements because they're nice bread and butter cases. And most importantly, patients do fantastic. And it's nice to have a patient with awful pain get better that day or the next day.
That's great to hear, to know that the future in terms of partnering with other professionals, also with the industry, opportunities lie there. If you would like to just share with what your handles are in terms of how you engage digitally in media for our audience.
It's Donnelly Spine Consult, one word, and that's on everything from LinkedIn to TikTok to YouTube to Instagram.
Once again, Dr. Donnelly, very appreciative of your time today with New Voices of Influence here at Live World.
Yeah, for sure. Anyone wants to reach out on any of those platforms, I'm happy to tell people kind of how I would recommend getting started. And the key part is in a HIPAA compliant way, especially those that are still in training. Those are the ones who are going to be more active in social media just based on their age group, but you got to be smart. You definitely could get kicked out of your training program if you use social media while in training. So that's kind of a big disclaimer I just want people to be careful of.
Oh, yeah, no, duly noted, and great to flag on that in terms of the right way to do that. And once again, thank you.